Good evening, everybody.
Hello.
Just a few more joining us, so we'll just let everybody come in before we get started. Certainly picked a good night to be inside, that's for sure. Just while we're waiting and everybody getting organised, coming in, what's everybody's level, handicap, or what they're looking to get out tonight, so that I've got a little bit of background as to who we're speaking with. That'd be helpful.
Right, hello. Hi, can you hear me?
I can.
You can, right? Okay, Stuart. So I'm using a different headset. Right, I'm John Roberts, obviously. I play off 21 2 or 3 times a week. I'm probably just looking to probably improve some of my strength and core around the course. A fair amount of running, do a lot of hot yoga, stuff like that anyway, but just looking for any hints and tips you can give me that might improve my game, either in distance, whatever. So, as you say, it's a rainy night. You've got an interesting subject. I'm happy to listen.
I'm sure you'll get good value then out of it, because that's exactly what we plan to cover. So there's lots of stuff involved with that. So
Thanks.
That'll be good. But thanks, John. I appreciate you sharing that. Okay. Well, we did say 8 o'clock. We're at 3 minutes past, so let's start on time, and we can just hopefully let anybody else in that comes on and joins us just very shortly. Okay. Okay, can everybody see the screen? You can see it, give me a wee thumbs up or some sort of feedback. That would be good. Excellent. Thank you, gents. Thank you. Much appreciated. Well, Pamela and John are in with the emojis and everything. That's mighty impressive. Good, good, good. Okay, so thank you very much, everybody, for giving up your time tonight and for joining us and for your interest in this session. Thanks very much also to David Dollar and Rona for helping put this on and putting us in touch with you. Really what we thought what we do is try to bring you a little bit of additional value to your game, and see if we can reduce some injuries, and give you a little bit of education tonight about some of the most common golf injuries. Because like this time of year is really the perfect opportunity to address some of your game and also get you ready for the season ahead. And it's often not used. It's the winter time where you're maybe not at the course or at the club as much, and it's okay. How can we give you some additional value? What can we do to get you ready for the season ahead? And this is the best time to address that. So what I wanted to cover tonight was what the most common golf injuries are, how to prevent them, and how by doing that could also add sort of 10 to 15 yards to your drive this winter. So I'm sure that would be of benefit to everybody. It will also mean that you'll have like more enjoyable time in the golf course with less pain, less discomfort, more freedom, means more time with your friends, means you don't miss out on golf. I had a patient in last year, for instance, who had like 20 years of a stiff, chronic, niggly back, nothing really too significant. And then he was simply bending over in March, injured his back, lost 6 months of the golf season, missed out on all the golf trips, missed out on all the golf days with his friends, and just couldn't play for a full year and missed out on the peak time of all the good weather. So we want to avoid that if we can, so you can get better value for money out your membership. And then if you're fit and healthy, then you can practice and improve consistency, improve your distances. But there's a couple of things that would really help accelerate that. And I want to speak to you about that as well. So a little bit about me, first of all. My background is initially in sports science and sport and exercise science at Strathclyde before going on to do physio, my master's in physio, worked in NHS for 7 years or so across various settings as a senior physio, and worked laterally with sort of 5 sites in East End of Glasgow, and sort of specialised in back pain and musculoskeletal injuries. I'm a golfer as well, not very regularly, it must be said these days, but I played a lot more when I was a student, that's for sure. But do enjoy golf. I was previously a member up at Eastwood as well before it unfortunately collapsed. And I'm a physiotherapist at OptimalPhysio. I'm the head physiotherapist there. We were based at Mares Castle Golf Academy for a number of years, 11 years actually to be precise. And then last year we moved into our own premises just down in Clarkston, so very close to all of you, I'm sure. But I've been in private practice now for over 12 years, but really do love working with golfers and helping them improve their game. So let's start with a few interesting facts. In terms of injury rate, 60% of professionals get injured every year, which is quite remarkable. But 40% of amateurs will also experience a traumatic or overuse golf injury. So the numbers are quite high. That means 40% of you on this call will experience an injury at some point this year. So really, if we can reduce that, that would be amazing. And the injury rate, it does sort of vary in terms of significance, but again, much higher rate of injury in professional golfers or lower handicap golfers. And I think that's really quite important, because the lower your handicap, the higher the risk of injury. And why does that happen? Simply because of the amount of time lower handicappers tend to practice. And practice is so much more intense than playing on the course. You hit a huge amount more volume, huge amount more repetition, and overuse injuries are therefore a lot more common. But it's simply related to the time practicing. Golf injury sites, I think most people would talk frequently about the elbow or the wrist and hand, which are number 2 and number 3. But without question, the lower back is by far the greatest risk of injury, and that's definitely reflective of what I see in the clinic as well. Yes, we see some shoulder stuff as well, but by and large, low back pain dominates when it comes to golf, and that's because it's such a rotational sport, and the amount of force and torque that we generate when we're rotating has a huge impact. And a lot of people are either sitting about at home, sitting about in the office, transfer from the office to their car, go straight up to golf, out onto the first tee, couple of swings, boom, off you go, trying to rotate and generate like massive amount of force and torque without really considering preparing your body for it. And that's something that we're going to talk about tonight as well. So from too much play or too much practice is clearly the #1 driver of injuries. Following that, it will be like poor swing mechanics and hitting the ground, and that's where the amateurs pick up most of their injury, through like poor swings, poor technique, hitting the ground, creating vibrational force, or overswing or poor warm-up. Whereas with professionals, it's purely overuse. Tends to be primarily overuse injuries, and also hitting the ground, but less so compared to amateurs. So you guys, much more related to either volume of practice, poor swing mechanics, or hitting the ground, or overswinging, or not warming up. So there's a number of things that we can do to minimize them, given the fact that they are the most likely causes of your golf injuries. So if you think 40% of you are going to be injured, that's those 4 or 5 reasons are going to take up 90% of them, 80 to 90% of them. So let's see if we can reduce the overuse injuries. Let's see if we can reduce the single traumatic events, and let's see if we can reduce the on-course injuries as well. So that basically puts it into order of the main causes of like injury risk factors. So certainly we can improve the volume of repetitive practice by mixing things up a little bit, and we'll touch on that. You can improve your optimal swing mechanics, but in that situation, I would direct you more towards David than me. You wouldn't want to be taking lessons off me, that's for sure. But there's things your body might not allow you to do that you want to be able to do. So inadequate warm-ups is basically not allowing time for that, and then not preparing yourself for the golf course and the forces that you're going to generate. And that's something we're definitely going to speak about in much more detail tonight. So the average course is about 7,200 yards, which is approximately 4 miles. Golf swing lasts about 2 seconds. So actually, during your day on the course, you're only actually swinging the club for about 4 or 5 minutes. Whereas you're out on the course for 3.5, 4 hours per round. When you think about the swings per round minus your putts, it's all to do with the force. And actually walking on the course, like on-course injuries are more likely to be related to even just the volume of standing and being on your feet, uneven ground, divots, stuff like that. That can all cause, contribute to it as well. But there's twice as much force that goes through the front foot, and your lead leg being the left if you're your typical right-handed golfer. So golf's much more demanding because it's an explosive, maximal torque, rotational speed type sport. It's a power event effectively, because you're trying to hit the ball usually as far as you can, or control your swing speed. Most amateurs though can't really control the tempo of their swing, so they always play full out shots, or prefer to play full out shots. But as you see golfers get older, you usually start to see their backswing reduce in length, and that creates a slightly different swing, and that's because they start to lose the rotation. They'll lose the rotation in their thoracic area, and they'll lose the rotation in their hips. which is where a lot of the drive comes from. As a consequence of that, the area in between your lower back, that takes the force. And that means the back can take the equivalent of sort of 8 times, between 3 and 8 times your body weight, which is more than what you would take when you were running, which is quite remarkable. And it's the effect of these repeated sessions that are really, really important, particularly if you're not conditioned to take those forces, i.e. you're not doing any sort of strength work. So about at least a third of all golf injuries are lower back injuries, and the leading cause is poor swing mechanics, but that's driven by poor mobility in the ankles, hips, and the thoracic area, i.e. your mid-chest, and that causes you to overload the back. So yes, we want to improve your swing, but in order to improve your swing, you need to have the range to be able to generate that rotational torque. Then once you've got the range, you need to have strength through that full available range to make sure that you can maximize and distribute the load much more evenly and be in control of the load as you move through different aspects of the swing and manage different transitions, accelerations, decelerations, etc. Now, as we age, obviously our mobility starts to decrease, but not only that, then we've also got to factor in injury history. So some people might have had problems with their hips, some people might have had problems with their knees, some people might have had or start to develop a little bit of mild osteoarthritis, and that's just becoming a bit stiff. But if you've had a career where your occupation was quite sedentary and you've not been a regular at doing like strength conditioning or mobility to condition you for golf, and it's really just walking and golf as your main activity, then as you get older, you'll start to find that your range of motion starts to get really limited. John kindly shared earlier on that he plays golf 2 to 3 times a week, but he also does a bit of yoga, which is fantastic, really, really good at maintaining your range of motion, maintaining your mobility, and improving your swing mechanics. So as we get older, that's going to minimize the decrease. But we do need to factor in what people's injury history is, so that we can make sure that we get the maximum out of our own bodies. There's no one swing, there's no one body that's going to be perfect, and we don't promote sort of perfect ideals, if you like. We want you to be yourself, be your own swing, have your own identity, but maximize the performance of your own body, factoring in your own injury history. But we really, given the fact that, like, for instance, people who have a disc problem, which is a large percentage of disc of back problems, then that can take sort of 4 to 5 months to heal, whereas a soft tissue injury might take between 2 to 4 weeks, certainly less than 6. But we certainly don't want people missing between 6 weeks and 5 months of the golf season. That's certainly what we want to avoid. So the muscle strain and the ligament stuff is usually localized to the lower back region. Usually a minor ache, and you can usually identify the sort of dullness of it. It's quite specific in terms of a muscle strain and positional. It changes very quickly. It's transient through a certain zone. The key, if you get a soft tissue injury, particularly in the initial stages, is not to stretch it. It usually feels tight. It might go into a little bit of spasm, but please don't stretch it. It wants to knit together again. So if you've strained it, you've usually overstretched it or pulled it. As a result of that, it will start to tighten up and contract a little bit. Let that be. Don't take any anti-inflammatories, because that's going to interrupt your natural healing process, and that might be a little bit different to some advice you've heard in the past. But keep it moving. Keep it moving within its pain-free range, and you'll definitely recover a lot quicker. That could easily take a week to 2 weeks off your recovery time if you just follow those principles. Disc injuries are more complicated and can vary, and are usually not such a smooth recovery as what you have with muscle strain, which is why they take longer. And it's all about graded load progressions as we recover from that. and they often refer pain into the buttock area or radiate across the midline of the back, like as a straight line across. And that's quite frequent. And they can also refer down the leg as well and into the groin and the hip, but mostly into the buttock and the posterior thigh. So that's something we'd definitely want to get assessed and make sure we can address quite quickly. Altered joint mechanics or motor control can just be a certain joint or a certain combination of joints that are not behaving properly or moving properly at different points in your movement, and that just maybe causes a couple of wee facet joints in your lower back or your SI joint to start to flare up a little bit. And then you've got arthritic changes as well, which just causes alterations to the joint, and it's a natural process of aging, but certainly arthritic changes are degenerative, they're progressive, so you need to maintain that. You need to be disciplined and consistent with that, and you want to keep pushing your range of motion, work into the stiffness and keep your strength up and keep using those joints. You don't want to avoid using those joints because you want to keep them working. Bone fractures and stress fractures are less common, but they are a factor, and they are usually more impact related than anything else. Management of low back pain obviously is about education, knowing exactly what's going on with it, knowing what type of injury you have, giving it the right approach. It might involve some soft tissue work. More than likely it'll enjoy a lot of it. There'll be a personal exercise plan to get you back as quickly as possible, and then an injury prevention plan to help keep you fit, but ideally we want to prevent it from happening in the first place. Something that a lot of people do as soon as they get an injury is rest it. And I don't want you to rest it. It doesn't matter how early you are in the injury recovery process, there'll be something that you can do to accelerate your recovery and get back. And simply by resting it and not exposing yourself to movement or exercise and avoiding things is not the way to go about it. So please don't just rest and think I'll just passively go away, and it might bring your pain down for a couple of days, but beyond that, it's not going to recondition the tissue, it's not going to remodel it, and it's not going to get you ready to get back to golf quickly. So you'll probably be quite pleased to hear that I'm not prescribing rest. I'm not a big lover of that at all. Once we're back to the stuff, as soon as you can get back to low impact aerobic exercise, then we can start to strengthen and mobilize and stretch your back once we're past the so for instance, a muscle injury, I said don't stretch. You can reintroduce stretching once it becomes pain-free on resisted testing. So once you can perform a movement pain-free, then you can return to stretching in that direction, that's for sure. So the three key areas where you're going to stay out that back pain bunker is your body, your technique, and your bag. So the first line of defense against low back pain is make sure that your back can move. Make sure you're not stiff in any directions. A lot of people who have had sedentary lifestyles or sedentary occupations, shall I say, not lifestyles, people who sit a lot, they're reasonably good at bending, but they're usually pretty rubbish at going back. And that creates a stiffness in the back area, which means you can't really extend your hips, and then your hips don't rotate as much as a consequence of that, and then that's how things start to develop, and your thoracic area doesn't rotate as much because you've been used to sitting all the time. But as soon as you can get those different directions moving well, then it can really optimize your golf swing and your rotational forces and the speed at which you can transfer and move through and manage your weight distribution much better. Ankle and shoulder mobility is important as well, like particularly your standing foot, your left foot, as you rotate through, because that's going to improve your balance. So if you've had a lot of ankle injuries over the years, maybe if you played football or played other sports in your youth, then that could have an impact on it. So we definitely want to address that. We also then want to get it strong through your range. So we want to get your core up. A lot of people talk about the core, but it is particularly important for golf, mainly your obliques and your shoulders and glutes and legs. So things like squats, side planks, shoulder press, maybe some overhead work. Like that's all going to work your core as well as the big movers. So big compound exercises are really going to be helpful for you. And it's important that we strengthen those abdominal muscles so that the spine and the chest and the thorax can all work together, and that connects the pelvis to your ribs. So it's important that we do that. So exercises like bird dogs, if you're familiar with any of the yoga positions, is really, really useful. Pilates, like that, those types of exercises are brilliant for golf, just brilliant. And that helps to increase the strength, which protects the back from injury as it can absorb more force as you rotate. A thorough warm-up is actually just a really, really effective way because it's a power sport. Now, if you're in a sub-maximal sport, whether it's walking or running, you maybe don't need to spend as much time warming up because you're operating in a certain way. But for golf, because you're generating maximal force, particularly with the driver or the longer sticks, then it's important that you do warm up. So that can include just building up the pace of your swing. It can involve maybe using 2 clubs and starting to add a bit of resistance to it, just so you're working through. There might be some movements and stretches. You might choose to do them in the house before you leave because maybe the weather conditions don't allow you to do it. Or maybe you're meeting your friends and you're a wee bit embarrassed and don't want to spend 10 to 15 minutes in the locker room doing a few stretches and going through a routine. But it really shouldn't take much longer than 10 minutes, just so that you're getting different joints loose and ready for the activity you're about to perform. But ideally, you build up and you grade your warm-up and it becomes progressive. So the last thing you should warm up with, it should be on the driving range. You shouldn't go straight to a driving range or straight to a practice range and get the driver out. You should start on the putting green, then the chipping, then you start to gradually lengthen as you sort of progress through the clubs, so that you're aiming to peak as you hit the first tee. Your technique's obviously important. Now, I'm not going to be the one to teach you or pretend to talk to you about X factor and triangles on the backswing and look at your TrackMan data, etc. That's for David. That's for the professionals to deal with. But having a sort of nice, smooth, rhythmical swing with good tempo, good balance, good strength, good freedom of movement, less resistance, it's going to minimize the muscle effort, minimize the load in the joint, maximize your force transfer, maximize your weight transfer, improve your club head speed, your distance control, your accuracy, all that. So the better your technique, the less likely you are to obviously get exposed to those different types of injuries. But the proper swing should have good movement at the shoulder, pelvis, thoracic area, lower back, and that's where we can help. We can help you with those different aspects of it, and then you can then transfer that into your golf practice as you're then able to move better. So it should be just a nice, easy, fluid swing. But poor swing mechanics and poor endurance and muscle imbalances will increase your overuse injuries. It'll increase your loads on your lumbar spine, your facet joints, and lead to fatigue earlier, will lead to poor control and inconsistency with your swing. The third and final thing is your bag. Now, repeatedly bending over to like pick up a bag that's like just on a wee stand can aggravate you. Having bag straps, if you carry your bag, I'd always encourage you to wear 2 straps rather than 1. Like a backpack, distribute the weight better. But better than that is to use a trolley. I'd encourage everybody to use a trolley. But if you've got it on wheels, try to push it rather than pull it from behind you, because then you won't be rotating. It's much easier. Keeps you in a much more neutral position. So always push the trolley rather than pull the trolley behind you. If you're trying to bend over to get something like put a tee in the ground, or pick the ball out of the hole when you've chipped in, then try to get a little bit closer to it, bend in a comfortable way, and use a golf club to support you as well on the other hand, so that you can just distribute the weight a wee bit better, tighten your abdominal muscles and bend from the knees and the hips. But try and create a sort of L-shaped triangle around the object you're trying to pick up. It always works much better. It's a much easier way to bend and pick things up. One of the final things that's really, really important, I know I've spoke a lot about strength, but if you do a strength program properly and you commit to it, then it should be done twice a week. 2 to 3 times a week is the perfect amount. If you're working in sort of 3 to 4 sets of 8 to 12 rep range and you've got appropriate resistance, then it can increase your club head speed by 7%. It can improve your strength significantly. It can improve your flexibility significantly, and it can easily add up to 15 yards to your golf game with no negative effects on accuracy. And that can be done in about 11 weeks, working on the shoulder, leg strength, and core work. That's the 3 areas of your focus. Now, 11 weeks from now takes us to the first week in May, which means this is the perfect time for you to get started, kick in, and be ready for the golf season and all the good weather and its finest. And then when you're during the golf season, you don't need to work your strength and conditioning as much. You just need to do it once a week from there on, across the season, to maintain your level of strength. And then when you come into the winter again next year, you up it to 2 or 3 times again as your golf tails off. And then you keep that going as a cycle. So you're strengthening through the winter, maintaining through the summer months. And that works really, really effectively. And just keeps you healthy, strong, and hopefully competitive on the golf course as well. So regular exercise, better warm-ups, better swim technique will help you improve your performance and reduce your injuries. So if that made a lot of sense to you, please follow us on social media if you like. We've got lots of other sort of tips and tricks and different advice and information on there. But as a thank you for coming on, if any of you have had any problems or have any difficulties with anything, I'd like to offer you a free 30-minute session with either myself or one of our physios in the clinic, where we can give you sort of one-to-one advice and a bit of a tailored approach for you and your own situation and your own injury history and whatever that really comes to, and whatever your goals are, so that we can help maintain your independence, maintain your freedom of movement with your golf practice, and keep you nice and loose as you're rotating through the ball. So if you'd like to take me up on that, I'd be delighted to see you. You'd be more than welcome. We'd look after you. Just drop me an email, reply to the email that the session was booked through, or it's just treatment@optimalphysio.co.uk, and if you contact us, give us a phone in the clinic. One of the girls would answer and get you sorted with that. But thank you very much for your time. I really appreciate it, and I'm happy to take any questions if anybody has any questions. Who's going to go first?
No questions at the moment, Stephen, but thanks very much. I found it very, very interesting, and I'll certainly be taking you up on your offer. Thank you.
Thanks, Harry. That's kind of you.
Yeah, I'd echo that as well, Stephen. Yeah, thanks very much. Very good presentation. Thank you.
Anybody got any questions then? If you don't want to ask a question, feel free just to type it into the chat if you're more comfortable doing it that way. I'm more than happy to take the questions that way as well.
No, you actually answered my question in your presentation, so which was going to be about carrying the bag, because I've been carrying my bag all winter rather than with using my trolley. So, but I'll go back to the trolley in summertime. But I didn't have winter wheels, so I've been carrying it. So I just hope I've not done myself an injury by carrying it all the time.
Well, hopefully you've been using 2 straps, so.
I have, yes. I didn't. I had a bag that just had 1 strap, but I treated myself to a bag with 2 straps, so that was a lot better.
Good, well done. It's just about minimising forces, minimising exposure, minimising risk. So in the winter, it's much more difficult, obviously, to use a trolley, and the greenkeepers obviously are not so happy about that in the winter. So. And we've got to keep them on side, that's for sure. That's for sure. Anything else? Any other questions at all? Nope.
Nope.
Nope. Okay, great. Well, please do take us up on the offer. We'd be delighted to see you, delighted to help you, and give you a wee bit more sort of specific one-to-one advice on us for free. So more than welcome to that. And otherwise, thank you very much for the evening. Hope you all have a very successful golf season. Hope you all avoid injuries and the weather's kind to us, and these storms certainly seem to pass. I think there's a wee bit of snow forecast for the weekend, so hopefully once that all gets by, then we'll get into the spring and we can enjoy a golf season like we had a couple of years ago, which was just perfect. Great. Okay.
Right, thanks a
Thank you
lot.
very much.
Cheers.
Take care. Look after yourself. Stay safe, everybody. Bye.
Thank you.